Hi. Today we'll just discuss why these days children tend to get a lot of dental cavities. So the two most important factors which are responsible for cavities in kids are the diet and oral hygiene. When we talk about diet, uh, kids not only have a lot of sugary food, but they also tend to eat a lot of sticky food. Sticky food could be in form of Maggi, pasta, spaghetti, pizza, donuts. So these sticky or the form of refined starch that these foods have, so they just get stuck on the biting surfaces of the teeth, and that is where the bacteria starts acting on and results in cavities. When we talk about oral hygiene, kids are not very proactive in brushing properly, and many a times kids who are without an adult supervision, they just put toothbrush in their mouth and they just rinse off their mouth without properly brushing. So there is one thing which many a times parents think that if their kids get cavities in milk teeth, it can be ignored because they feel that milk teeth will eventually fall off. However, the same is not true. If there is any cavity in a milk tooth, it should be taken care of, and you must visit a dentist to address the problem, because the infection, if there is a cavity in a milk tooth and if it is ignored for a long period, it might involve the nerve and may result in infection, and an infected milk tooth may affect an underlying developing tooth germ, permanent tooth germ. So the permanent tooth buds, they are right below the milk teeth. So if you're not treating the issue, if it is infected, it will affect the underlying tooth germ. Now, how can we prevent cavities in kids? First and foremost, you should avoid giving them a lot of sticky food. However, it's very difficult to convince kids to not eat sticky food, but you can always add a lot of fibrous food to their diet. And whenever they eat, you should make sure that the child takes a sip of water in his mouth, swirls it around all his teeth and spit it out. Second thing, when it comes to brushing, kids below 6 years should always be supervised by adults, and you must make sure that kids brush at least for 3 to 4 minutes. And also, you must visit a dentist. You must get your kids' dental examination done once in 6 months. There are a lot of preventive therapies also available, such as fluoride therapy, pit and fissure sealant therapy, because it's widely said that prevention is better than cure. So if the child is regularly visiting a dentist, and if the dentist feels that he has more propensity to develop cavities, so he can always do these therapies for the child so that he doesn't get more cavities in future. Thank you.